Well, there are two objectives with today's conference. One is to really make people more aware of what the Senate is, who the Senate is, and what it can offer to them in the way of reports and services and advice to face up to some of the challenges that we see in all of the things that we get asked about as a Senate.
The current model of the NHS is not what we want or not what we need. There is many areas where patients are not getting the quality of service they deserve, and that is why we need to redesign services. The Clinical Senate is a fairly unique body of a mixture of clinicians, doctors, nurses, public health, mental health, lots of different areas of expertise, and they meet together and they can form a very rich and valued view of proposals, so that people can actually understand where the gaps might be in their service proposals, and I find that with the level of expertise we've got, we're able to really show people the way forward.
In terms of the breadth of the skills they've got around that table, it's fantastic, from lay members all the way through obviously to clinical people. So I think anybody who is looking at this, it's well worth talking to Chris around actually what they can offer. Certainly from my perspective, I think it's a sound base that we will use to use our evidence going forward.
It's been very varied in the presentations. It's interesting how many common themes there are and how partnership is key to making best use of resources and ensuring high quality care for children and people across the North of Yorkshire and also everywhere in the UK.
There were some interesting thoughts about quality and resources and how the two are offset and what we should be doing to try and improve our services. A lot about the approach to reconfiguration of services, which is relevant to all of us, I would say, who work in the NHS. And I think it would have been of interest to any health professional really that works in the NHS.
It was probably the first time I've actually seen the Clinical Senate in action and what it could do. So I think it's got some very positive things that can help with, and sort of shine a sort of like critical clinical light on things, so that you're getting sort of a view from outside about what you might be doing in CCGs or trusts or STPs, and what's the best way ahead.
Yeah, so the Clinical Senate came and helped us in East Cheshire with our CCG colleagues and other partners. We've got some major issues as a small district general hospital around sustaining acute services. We've got a range of ideas, and what we really wanted is the Senate, it's some independent clinical advice to test us with those, to make sure that we hadn't missed anything that was unintended around that, and to give us a bit of a précis back around which ones they think will be the best options.
Certainly far more aware now of what the Senate does and its function. Can understand the challenges it faces and how it is useful in providing that objectivity in looking at system changes with a clear methodology too. So yes, it looks a very helpful facility in the NHS, and there will be many difficult decisions to make going forward, and this kind of organisation will be very helpful in facilitating progress.
They've taken away that the Clinical Senate is a useful friend, in that you can ask them the Senate questions, you can get responses, but some of the responses will be very challenging. We don't always give everybody the easy answer.
Clinical Senates have been a new part of the architecture that we've had for a couple of years, and I think they've really established themselves as a source of sound clinical advice and a bit of challenge to people who are contemplating making changes in health services. I think the Senates in the North have distinguished themselves in a number of reviews that I've seen. They've stood up to legal challenge, and indeed we've had a couple of judicial reviews where the Senate evidence has often been cited as being an important part of the decision that has enabled local systems to move forward. Clearly we're facing change, and change in geography in terms of the new regions within NHS England, and of course the move to STPs and ICSs. But I don't see that the need for clinical senates is going to disappear, and I'm sure they'll evolve and continue to provide advice into the future.